If you are tired, if you have heavy, achy, swollen legs, well, you could have venous reflux. And we're going to talk about that today and a brand new, exciting cure that's a little bit kinder. It's not really a cure, but it's a treatment. And it's a little bit kinder than some of those, invasive procedures that they do. So we have Dr. Pete Jensen here with us today. He is with the Utah Vein Specialist located at Altaview Hospital. How are you this morning?
I'm fine, thank you very much.
It's really nice to have you here today because we're talking about venous reflux. And first of all, can you kind of give us a description? What is that?
Venous reflux is when the valves in the veins, they're little valves that assure that the blood keeps moving upward toward the heart. The valves in the veins start to function inappropriately, and they allow blood to pool in the legs. And the things that bring this on are genetics, pregnancy, occupational things that keep us on our feet or keep our legs down and inactive, sometimes trauma, things like that. And I think if we could all walk on our hands, none of us would have it. But the fact is, the longer we all live, the more these valves see pressure and they start to leak and allow the blood to pool in the limbs.
Does it start with varicose veins? Is this a symptom of varicose veins?
The varicose veins are actually a tip of the iceberg. The early problem that starts is the valves start to fail. So the varicose veins are actually, and spider veins, become kind of the end of the line, not the beginning. The early symptoms are the heavy, achy, tired leg. Those symptoms are usually worse as the day goes on. Sometimes people have swelling when they've been in a car or a plane for 4 or 5 hours and they notice that their feet or their shoes are fitting differently because their feet have started to get swollen. And what you have there is the blood that's trying to move up back to the heart in the shallow circuit, not in the deep, is starting to pool. And so varicose veins become the end of the line as the blood is pooled and kind of extended those veins as a place to put the volume that they're carrying.
So tell me about this procedure. What are you doing now that's so up and coming, that's so helpful for people?
Well, the old way to manage this was twofold. Number one, stripping. It was brutal, barbaric. Everybody's got a grandmother or a mom or somebody's had vein stripping, and it was just awful. And the real advances in vein care now are really twofold. Number one, much better diagnosis. If you give me those symptoms, they can be vague, and I have to really pin them on the veins, and I do that with a very carefully applied ultrasound, which is not just your standard rule-out deep clot ultrasound, but is an ultrasound that assesses the functional anatomy of the veins. And then to treat leaking veins that are causing symptoms or problems, what's the difference now is not stripping, but instead through a very small needle poke done under local anesthetic, so no more than you'd get for a filling at a dentist. I can put a catheter in the vein, and after applying local anesthesia around the vein, again, all with an awake patient who's driven in and will probably drive home, I can withdraw the catheter, and as I withdraw it, apply heat to the vein. That heat shrinks the collagen in the vein wall, that's the protein that holds the vein open, and it ruins the internal lining of the vein, so-called the endothelium, and the vein scars shut. So instead of ripping it out, as if I've started a lawnmower or a snowblower, I've now closed the vein, apply a Band-Aid over the top of that, and someone walks out with an ace bandage on.
And the pain for the patient is?
The recovery is much faster. People they drive themselves home. I ask them to kind of take it easy for a day or two. Usually non-steroidal like ibuprofen medication is plenty for pain control, and I let them go back to full activities after 2 weeks, but I'll let them do walking, ellipticals and bicycles and so forth up through that time.
Dr. Pete Jensen, this is fascinating. And I think, excuse me, there are so many people out there who are going to be excited to call you and get their
babies in this valley and in this state get born, and people want their legs back.
On your legs.
Get the legs back. All right, if you are interested in talking to Dr. Pete Jensen, he is with the Utah Vein Specialist at 9690 South 13th East. That's on the Altaview Hospital campus. The number to call is 501-VEIN, or you can go to veinsmatter.com, and we will put all of that information on our website, abc4.com. Thank you, Dr. Jensen.
Thank you very much.